Hi everybody, in this segment we're going to be talking about our lower limb, beginning with the pelvic girdle. This is the place that our lower limb bones attach to our axial skeleton. And that pelvic girdle of pelvis is made up of these two hip bones. So this would be a right hip bone, and this over here is a left hip bone or left os cocci. And then they would fuse with the sacrum posteriorly to create what we know as the pelvis. So when they're disarticulated like this, it can be a little bit challenging to orient yourself to what we're seeing. So let's look at how these two bones would articulate with one another. So we're going to take the pubis, which is located here, and the pubis located here, and we're going to put them together. Now this should start to resemble something more like what you're used to seeing with the hips. So we have that broad flared portion of the hip here, and then the bottom of the hip here, the inferior portion, superior portion, and then the space in the back is where that sacrum would be sitting, would be articulating. So we're going to start off using we'll go ahead and use our left hip here, left hip bone or os cocci. And it is very oddly shaped. I'm going to turn it around for you. This is the medial surface. This is the lateral surface of the bone. I can recognize this as the lateral surface really quickly and easily because of this. This is called the acetabulum. And that acetabulum is where the femur is going to fit. The head of the femur is going to fit right into this to create our hip joint. The acetabulum is also really important because it's the fusion point where the three bones come together. So the superior bone that we see up here, this is all called the ilium. The anterior bone here is called the pubis, and then this posterior inferior bone, which we see back here, is called the ischium. So ischium, pubis, and then ilium. And if you'd like to take this hip bone and divide it up into the three smaller bones, you can actually use this acetabulum as a place to do that. So your first cut or line would go right through the acetabulum and through this big hole we see here called the obturator foramen. So there's the obturator foramen, a little teensy tiny nerve called the obturator nerve goes through there. So that would be our first line or division. And then we want to take the acetabulum from there and divide it into thirds. So here is 1/3. Everything between my two fingers is the pubis. My other third would go right around about here. So everything between this point and here is my ischium. And then if I was to complete that third division here and here, the superior portion of the bone is my ilium. Now we're going to go through each of those three subdivisions in greater detail next. But remember that we can tell lateral by using this acetabulum. If we go to the medial side of the bone, it's nice and smooth. In fact, we have a depression here, which is going to be our first part of the ilium. This is called the iliac fossa, this depression. And it's an attachment point for a muscle that we'll learn in the next unit. I'm going to move back out to the lateral view. And what I notice as I'm looking at this ilium is that we have several sharp processes that stick off. A sharp, slender process is called a spine on a bone. And this ilium contains 4 spines. 1, 2 on the front, and 1, 2 on the back. So we need to differentiate between these 4 spines. The ones on the front are going to be called anterior spines, and the ones on the back are called posterior spines. Because there are 4 of them, we need to get a little bit more specific with our name. This is the anterior superior iliac spine and the anterior inferior iliac spine. On the posterior side of the bone, posterior superior iliac spine, posterior inferior iliac spine. Also present on this ilium is the iliac crest. A crest is a ridge of bone, so this is our iliac crest. The greater sciatic notch here, the sciatic nerve is going to pass through that greater sciatic notch. And then again, on the medial surface, the smooth part is the iliac fossa. Excellent. Let's move on to our next bone. We're going to look at the pubis next. So remember, the pubis is going to extend from here to here. It's the anterior portion of our bone. And we see a couple things on this pubis. First, I see a small rounded knob-like projection. That's a tubercle, and it's not the first time we've seen tubercle. We saw a tubercle in a rib. This tubercle is on the pubis, so we're going to call it the pubic tubercle. Again, we've got things that attach to that bump, which is why we're making you learn it. Now, if I had both halves of my pubis, like so, there is a joint that sits in between the two halves. So in this small space that we see here, it's called the pubic symphysis. It's a cartilaginous joint. It's made out of fibrocartilage, and we don't see it here, so we can't identify it on the bare bone. Okay, let's move now to our posteriormost bone. This right here is our ischium. So our ischium is on the posterior side. Ischium has a huge rough spot here. It's called the ischial tuberosity. It's your butt bone. So if you, let's feel for a second. If you can sit down on your hand and kind of rock back and forth on that hand as you're sitting on it, and you're going to feel this sort of bone inside of your butt bone. That's your ischial tuberosity. It's very rough. Several different muscles are going to be attaching to that ischial tuberosity. I also see back here a sharp, slender process, and we know that that's called a spine. So that's my ischial spine. That ischial spine is a great landmark to divide our greater sciatic notch, which was part of our ilium, and our lesser sciatic notch, which is part of our ischium. All right, we're going to run through those same structures using our other hip bone now. So here we go. This is our lateral view. We can tell right away by seeing that acetabulum, this, obturator foramen. If I move to the medial view, I get that nice smooth spot on my ilium, which is my iliac fossa. All right, let's put it back in our lateral view now. Let's start with the ilium. So we already got the iliac fossa. This is the iliac crest. On the front, anterior superior iliac spine, anterior inferior iliac spine. And then on the back, posterior superior iliac spine, posterior inferior iliac spine, and that large notch there, the greater sciatic notch. Okay, next looking at our pubis up front, we see our pubic tubercle, and then the pubic symphysis would sit here, but it's not present. Next to our ischium, we have the big rough spot, which is the ischial tuberosity, and then over here, the ischial spine. And remember that that ischial spine is going to be dividing the greater sciatic notch and the lesser sciatic notch.